Institute of Mental Health, celebrating our 50th anniversary year. My name is Tom Pansella with MIMH, and I'd like to thank you for taking the time to join us this afternoon. I'll introduce our speaker to you in just a moment. But for those of you watching online, if you'd like to ask questions, submit them using the chat window underneath the video window. You'll see a little box next to the word Say. Type your comment in. Hit Say, and that'll add your comment or your question. We'll ask those on your behalf, more than likely at the end of the presentation time. But please feel free to submit those questions or comments at any time during the presentation. If you're interested in CEUs for today's program, you'll see, if you scroll down, a link to purchase CEUs. They're only $10 a person, and you can submit those at any time during or following the presentation. We'll also send that link to you in a follow-up. Right around that space, too, you will see two more links, one to the slides and another to a document that Sandy's going to be talking about with us in just a moment. So now I'd like to introduce Sandy Dailey. And Sandy enhances lives as she communicates usable Medicare information to people of varied ages and educational levels. 22 years' work with seniors and people with mental illness launched her into the CLAIM program, which is Missouri's SHIP. In September of 2009, a strong desire to help people understand their Medicare benefits carried her through the challenge of mastering in order to teach the complex Medicare alphabet. Sandy provides training for volunteer SHIP counselors, welcome to Medicare events for people new to Medicare, and presentations to community groups as well as individual counseling, all to help people understand and get the most for their money with their Medicare. For those of you who have been with the Department of Mental Health or with anywhere in Missouri and have been to a couple of our programs or some other of the association conferences in Missouri, you've probably seen Sandy staffing an exhibit table at some point. So Sandy, welcome to St. Louis, and thanks for joining us. The floor is yours.
All righty. Thanks, Tom. This is a real pleasure for me to be able to talk to you. The only thing I wish was that you might be able to be in the room with us, because then I could get to know you a little better. But what I'm guessing is that you may be one of the following groups. You may just want to know more about Medicare. You may already have Medicare, or you may be helping a friend or family member who has Medicare. You may help people through your job with their Medicare. You may also be from Missouri, or you may be in another state. So I'm trying to gear the talk for all of you. I was a person who didn't know anything about Medicare until a little over 3 years ago when I got this job. And I'm having a feeling that maybe some of you are like that also. Actually, I don't know that I would have tuned in to this if I were like you back then, just because I'm the kind of person who kind of lets things roll along. My insurance needs have been taken care of by an employer for the most part. And so I could have turned 65 without having a clue how to sign up for Medicare. There are people who do that, and unfortunately, if you let that go over a year, that could amount to a penalty. So there are things to know about enrolling in Medicare. We help people in a lot of ways. And so I'm glad you're here with us today, and I'm hoping that this presentation will help you. First of all, I wanted to make sure y'all know, let me see, let's move this on, that every state has a SHIP. Now, when I came home and told my husband I was working for a SHIP, I had to say that very carefully, but it is an acronym. We have lots of acronyms in the Medicare world, but the truth is we are here to help. No matter what state you're in, there is a state health insurance assistance program to help you with your Medicare questions. And so we're here to help. And excuse me, unfortunately, it seems like we are sometimes the best kept secret, and we don't want to be that. So spread the word. If there's anyone with a Medicare question, we're here to help. And you can just call, wherever you are, you can call one of the 54 state health insurance assistance programs, because every state and territories have them as well. Now, in Missouri, the state health insurance assistance program is CLAIM. CLAIM stands for Community Leaders Assisting the Insured of Missouri. What SHIPs do. We provide free, confidential, unbiased information and guidance. And this is very important. We do not allow a person to be a claim counselor who has sold insurance in the last year. There's nothing that the SHIP counselor benefits from with this counseling. We're just here to help advise people and empower them. We help people make informed decisions related to their Medicare. And we're also the kind of feelers in the community. If we see something going on that's disturbing to Medicare beneficiaries, or if we think something just isn't quite right, we can report back to the Centers of Medicare and Medicaid Services any of these problems and concerns. So it's good every way to help the beneficiaries. Okay. In Missouri, the SHIP, or the claim program, has been funded by the Missouri Department of Insurance, Financial Institutions, and Professional Registration. And this started in 1993 when the grant first started. Primaris is a healthcare consulting company and has been awarded this contract through the Department of Insurance since 1993. We thrive on community partners. We try to continually get more community partners throughout the state who are able to reach more people in their community with the help we offer. In Missouri, we have more than 50 organizations, and these provide counseling sites, and they also connect beneficiaries to the counseling. We have professional organizations, we have hospitals, lots of different groups, libraries, and other work groups where we train the counselors within the group, so that these are called in-kind counselors. In other words, they can work with this on their job to help the people with their Medicare questions. And so these partners are truly a vital link between Medicare and Medicare beneficiaries. And why would you call CLAIM? Why would you call your state health insurance assistance program? Well, number one, to find out the best Part D plan for the coming year. The open enrollment time is October 15th through December 7th. This is the time when people can make a change for the following year. If they do choose a new plan, it starts January 1st. This is really an important thing to know about the insurance world. There are only certain times when you can change a plan. And the reason you should change, or at least review your plan, is because every year the plans change. So the formularies of how they handle a person's medications are always changing. So from year to year, a person shouldn't just trust the fact that, well, they like the name of the plan, they're going to stick with it, it worked great last year. It could possibly drop one of their medications, and so they could be in for a big surprise at the beginning of the year when they try to fill their prescription drugs and find out that they're really more expensive. So that's one reason to call. You might just be one of those people who didn't read your mail. Maybe you were getting extra help paying for your medicine last year. You, in the fall, received mail but possibly didn't open it to find out that you were supposed to resubmit your application for extra help. And so your plan is way more expensive in the coming year. And we can usually help with that too. Of course, number one, it would be better to read your mail. And then, why else would you call? To learn about Medicare when you're new to Medicare. Either if you've had a Social Security disability for 2 years and are going to qualify for Medicare that way, or if you're turning 65. Then there are really important decisions to make and things to do to make sure that you're covered the best way and the least expensive way. So we have a call center with wonderful people answering the phone trying to help as many people as possible, as quick as possible. Sometimes it's a really busy call center. But what they do is answer calls from people with Medicare. Here's our toll-free number, and it'll be on another slide as well. What the call staff does is collect information from each caller and then send this on as a referral to this is how it often works anyway, to a counselor in the person's area. So if you live in the Boot Hill, if you live in Cape Girardeau, wherever you live around the state, somebody from your area will likely be the one to call you back and to answer your call to try to address your issue. Counselors call within 3 business days to offer assistance after they have placed their call with the call center. And yet when a professional calls, if you're trying to help someone with their Medicare problem, and especially whenever possible, we try to take that call right away or at least call you back within the day. Now, if you do have a beneficiary from Medicare in your office with you and you know it's really time sensitive because you don't get to be with the person and they don't have a phone, something like that, we definitely try to take you whenever possible right away. Claim counselors. We work very hard to address each problem, and sometimes it takes some detective work. Sometimes it's kind of hard to figure out what the question is, because when the call center writes the question or the problem, and then before we call back, we try to do some research to make sure we're prepared. Sometimes when we really sort things out, we realize, well, that's not really exactly what we thought it was going to be, but let's help you with what we can. So we do our best to sort these things out to try to find out how we can help. And when the counselor is in the person's locale, it's easier for them sometimes to understand and relate to the questions the person might have. Our counselors are trained and certified. It takes 4.5 days of initial training to learn the basics, and then ongoing training throughout the year is offered so that people can just brush up on the latest, because there are always changes in Medicare. And so that's another reason why we're here. But we are a team, and it's often so helpful just to talk to other counselors to make sure that you're counseling in the proper way. So we are always here to help our counselors. And let me just put in a plug right now. If you're a person thinking, I might want to do this, we want you. So do call if you're interested in being one of our trained certified Medicare counselors. We'd love to offer this training. It's free training, and we are always looking for more counselors and more partners in your area. When you would be doing this on the job, if you're an in-kind counselor, then we would definitely want to have a partnership with your organization, and they would become a community partner at the level they wish to. We have some community partners who are a host site for meetings, like libraries are often that, and then we have some with the full gamut of having counselors that work out of their office. Complicated questions. I'm just offering a few samples here. There are some that are really complicated. We have to dig deep. Sometimes we have to assist for months and months, I think over a year in some cases, trying to help a person get back what they think they paid too much for, or just appeal a claim. We've had this more than once, actually. Someone who was recently released from prison and they need medicine. Well, we have to go through a lot of research trying to figure out, well, what do they qualify for? What did they have in the past, and how can we help them? But we have helped in that way, and that's a great feeling. Possibly a new enrollee who has to decide, do they want a Medicare supplement or an Advantage plan? And sometimes those terms are even complicated. People think an Advantage plan is a supplement, when indeed it's a supplement is also called a Medigap. Yeah, the terms and the ABCs of Medicare can be complicated. but we do a lot to help a person make an informed decision. Beneficiaries who want to know how Medicaid spend-down works with Medicare. And that, again, is kind of a dance. We try to help, but of course the person's caseworker will try to help too with on the MoHealthNet side. Who calls us? They might be a Medicare beneficiary or the caregiver families assisting a Medicare beneficiary. We do have the advantage also of being able to call Medicare Direct as a claim state health insurance program, assistance program counselor. We can call direct without a waiting period and get some questions answered if we need more information about these people we're trying to help. Professionals requesting information and assistance. Often social workers will give us a call. They're looking for the best cost for a person. They're thinking a person possibly is being charged too much. Maybe they are trying to get a person the extra programs to help pay for their medicine or their Medicare. And then sometimes we figure out it's just a lonely person who wants to talk. I mean, really, this is true. We have people who sometimes are called frequent callers, and we do what we can to help them. But I just actually put that in to be funny. But it is often true. So here's a list of different things that we help people with. Enrollment. Like I said, it can be complicated. If a person is still working and has an employer group health plan, when they turn 65, they can turn down Part B, which is the outpatient part of Medicare. The ABCs of Medicare. A is I like to think of it when you're admitted, so that's hospital. B is outpatient. C then is when A and B are taken over by a private company, and that's an Advantage plan. So A and B together are called Original Medicare. C, the Advantage plan, and then D is the prescription drug plan. And some of the Medicare Advantage plans do have the prescription drug with them. So enrollment, like I say, it can have some decisions that you need to make. At the time of enrollment, either when a person is, in Missouri anyway, in Missouri, a person who is on disability Medicare is allowed to get a Medicare supplement. And so that's really an advantage to them. They have what they call guaranteed issue to get a supplement when they first become eligible for Medicare, when they're under 65, and then another guaranteed issue when they become eligible and age into Medicare at 65. This guaranteed issue is the ability to get a plan without being given a physical, so without having being analyzed for pre-existing conditions. And so that's the supplement, or Medigap is what that is. So that's another decision to make when you're enrolled, because you have 6 months. I want to quote. There are a lot of different time periods, but after you become eligible for Medicare, there is a 6-month period when you can get your guaranteed issue, your supplement that way, if you decide to do that. And so those are important dates to know. Part D comparisons are very important, like I say, every year. There are certain people who have extra or special enrollment periods, so they don't have to only do it between October 15th and December 7th to begin the new year. And we'll talk a little bit more about those types of special enrollment periods. We help people with Missouri RX. That gives one special enrollment period. If you know anybody who might qualify for Missouri RX, they fill out this application and send it in, and it helps pay for their medicine, half of their copay and half of their deductible. We help people with extra help through Social Security. And we help them sign up if we feel like they qualify and they don't already have it. And we can sign up. We have a paper copy or do that online. MoHealthNet, we have MoHealthNet applications, and that is especially is important for the people who qualify for what we call a Medicare Savings Program, and we use that application. And then billing issues are things we help with. If people just are confused by the bill, they need help reading their summary notice from Medicare, or if they need to file a complaint or an appeal. We also have our antennas out to make sure that there isn't fraud and abuse going on, and we can report that if needed. People are being really careful, and so they do call in if they think they should look at their summary notice to say, did I really see that doctor, or did this get billed twice? And so they're helping us watch as well. Appeals and grievances are things we help with, and we can also help advise on long-term care insurance. We don't get involved a whole lot. We can offer guidance, though, and information. Okay, back to the assistance programs. If you have this handout right here, there is help with Medicare costs. I like to refer to this. This is a simple thing to even give to people if needed. And we start at the top. If we're trying to get help with a person, for a person, one way to do this is to start with the Missouri RX, because they don't even look at the resources a person have. They only look at the income, and they're the most generous with the income. So we're very fortunate in Missouri to still have this program available. Like I said earlier, it pays half of the deductible and half of the copay for the Part D plan. And then to apply, they need this application, and we'd be glad to send them one. Or and then they do send in a copy of their Medicare card. It has instructions here and a copy of their Social Security card for Missouri RX to review this. Within about 10 days, they'll get an extra card for Missouri RX that works with their Part D plan. The Missouri RX only works if you have a Medicare prescription drug plan, either through your Medicare Advantage plan or through your Part D plan. Another way to get extra help, to get help with Medicare, is the extra help through Social Security. That's the next one down. This is specifically for your Part D plan, your drug plan, and it really reduces the premiums. The extra help with Social Security is also called Limited Income Subsidy, or LIS. So we use lots of terms. And depending on where you fit in your income level and assets, it does depend how greatly reduced your costs will be. But to apply for that, you can do this on socialsecurity.gov, or you could use a paper copy and send it in here. Then we go to the Medicare Savings Programs, which are more commonly known by initials, and sometimes we put names to the initials. So the upper level one is QI1, Qualifying Individual 1. Then the next one down is SLMB. We call that Slim B, but that's Specified Low Income Medicare Beneficiary. And then the QMB is right, the lowest level here that gives your highest benefit, and that's Qualified Medicare Beneficiary. So if you look at this chart, you'll have to make sure that their resources and their income monthly line up with this, and it's different whether they're married or single. And And if either one of those three programs fit for a person, they can use a Medicaid or MoHealthNet application. And what they do here is they clearly mark payment for Medicare premiums down here. And that's why they're applying, because they'll have, most likely, they will have greater assets, greater income than Medicaid or MoHealthNet, but this is what we're applying for. And those programs can pay for their Part B premiums. They can greatly reduce the Part D costs, and then they also have added benefits at times. I mean, especially the QMB, cost sharing. The QMB is the only one that works with an Advantage plan of these three programs. And there's another thing to know. If a person is on a Medicaid spend down, then the QI1 does not work. You can't have both, a QI1 and a Medicaid spend down. Okay, so this might be going kind of fast. The bottom level here shows what a person who qualifies for MoHealthNet can have in the bank and can make, and what that can do, how that helps. By the way, Medicaid or MoHealthNet does not work with a Medicare Advantage plan. So there are some ins and outs here of how to know about how to get people the best cost, what they qualify for. Okay, so we started here with MoRx. We also talked about the extra help with Social Security and the Medicare Savings Program through the Department of Family Support, MoHealthNet. Those are all very helpful. Now, there is a special enrollment period for your Part D, meaning one extra time throughout the year if you have MoRx, and then the next three here offer you an ability to change your plan anytime, any month of the year, so that if your medicines do change, you can get the cheapest plan and the best plan. So if you needed to, you could change it any month. And whatever you do this month starts the first day of the following month. Here are some of the important deadlines. People who are new to Medicare, they have 3 months before to sign up, before their, let's say their birthday's in May. They would have the 3 months before May, the month of May, and the 3 months after May to sign up for their Medicare to begin. There's an open enrollment period for the Part D, as I said, which is October 15th through December 7th, and the new plan starts January 1st. And then I mentioned the special enrollment periods for the Part D. There are also other enrollment periods. Let's say we have whole lists of if your employer group health plan ended, then you have a certain amount of days to start or to pick a new plan. So we can help you with a lot of that. I'm not going to go into all that detail. Advantage plan disenrollment. There is now a time between January 1st and Valentine's Day, February 14th, when you could get out of a Medicare Advantage plan. That's that Part C plan, if you'd like to. So, and then you just have to go back to original Medicare, not a different Advantage plan. But you can get a Part D plan instead. And then, as I was saying, the guaranteed issue when you're new to Medicare, either under 65 through disability or when you age in, you have the 6 months to decide. There's also the thing to know about your Part B plan and signing up on time. Well, there's a few things to know. If you already get a Social Security check before this begins, then you will be getting your Medicare card in the mail. And there are things you can decide whether you want to keep your B or not. But if you're not getting mail from Social Security, then you really have to make the gesture of either signing up for Medicare on Medicare.gov or calling them or going into your Social Security office, because they're the ones who sign you up for Medicare. And if you miss that 6-month window around when you're eligible for your Medicare to begin, then you have to wait for the general enrollment period, which is every year, January, February, March, and then your Medicare wouldn't start until the following July. So this can get complicated, and I wouldn't want anyone to be surprised and to miss what is easiest for them to sign up when it's first available. Okay, we try to do talks. This is a great opportunity here. We try to go to groups. We want to let you know we're available to speak for groups throughout the state. We do the presentations for beneficiaries or caregivers, professionals. If you need to know more about Medicare, we do have people throughout the state who can come and, when prearranged, present to your group. We also, like Tom said, you might have seen me at a health fair or a booth at a conference. We offer handouts, informational brochures. There are a lot of books that the CMS puts out about Medicare that we can offer to you. And then we also try to have various locations for Welcome to Medicare events where people who are new to Medicare can come and get their questions answered, so they kind of know. We had one last year, and a man realized, well, if he didn't get a Part D plan, even though he didn't take many medicines, if he didn't get one now when he qualified, there would be a penalty if he decides months or years later to get one. There's actually a penalty assessed every month you don't have one when you qualify. So he said, I decided I'm going to get one. And he wouldn't have known that ahead of time. So Welcome to Medicare events are another way we try to reach out and share information. Okay, we're moving pretty fast here. These are some related websites. If you are not from Missouri, or if you have a friend or relative you're trying to help in another state, let them know that they can go on the shiptalk.org to find and look for your state, to find a SHIP in your area. Medicare.gov is full of information. It helps us do a personal search to find the best. We put in medicines and the zip code for a person, and that helps us find the cheapest plan for their prescription drugs next year. That's one thing we do with that, but there is loads of information provided on Medicare.gov. People on Medicare can actually keep their file and see their records on their own site on Medicare.gov also. Then socialsecurity.gov, that's a very user-friendly website in my opinion, and it does help us sign people up for limited income subsidies, and there are other things you can do on that side, of course, as well. And then the Department of Insurance, they also provide a really great book here in Missouri. This is our Medigap shopping guide in Missouri, and we can send these out to you. And it has more than just your Medigap in it. Just to let you know about the alphabet for Medicare, I taught you the A is for admitted, B is outpatient, C is Medicare Advantage, D is prescription drugs. Well, the supplements have their own alphabet, and it's made as clear as possible in this book, and through the Department of Insurance, they have their own alphabet too, and they reuse some of the same letters. But when we send these out to a person trying to shop for a supplement, and then we can even talk to them on the phone, knowing what they're looking at, what page. We can explain how what benefits they might want to choose. So Department of Insurance has the great website. What do we do now? And it also provides these printed things, along with this book telling about the supplements. Are the rate guides, because the rates change often, and so they try to keep them more up to date. And so when you get these, you can find your age group, and then each age group has about 3 pages of different rates. The truth about a supplement is, if you pick a letter, let's say F, which provides the most services, F as in Frank, if you pick that letter, every company can charge a different amount for the same services. So that's why you would want to shop around. One of the other good things that we have in Missouri is the opportunity to change every year. If you have a supplement and it started, let's say the anniversary is in November for you, this same anniversary date is yours as you continue to keep your supplement. So the month before and the month after your anniversary date, you can switch to a different plan within the same letter of your supplement. And so once again, we try to equip people with the information so they know, do I want to keep the same one, or should I figure out, can I save money with a different company? One of the slides, and how I mentioned people might find themselves in trouble because they didn't read their mail. This is a consumer guide, and if any of you need one of these, Kelly said he could help make this available. CMS sends out color-coded letters, and if a person calls you up, if you're trying to help a consumer, and they say, I got a gray letter, this is a good guide to know. In September, they sent out letters that were gray, and it says loss of deemed status, and it informs people that they are no longer automatically qualified for extra help. And then it tells them what to do. They need to apply through Social Security. So it's just kind of helpful for us when they call us up and they tell us what color the letter is. It gives us a little tool to figure out what to do next. Did you get any questions yet?
We've not gotten any questions, but we do encourage people, if they do have questions, to use the chat window underneath the video screen. Type your question next to the word "say" and click the word "say." Do you have more to continue on here?
I had one more thought. Okay, look. Along the lines of extra help, if a person has a Medicaid spend down, and if they meet their spend down one time in the year, that qualifies for them for the LIS level of extra help. So they really can save a lot of money on their prescription drugs if they meet their spend down one time a year. And that's one thing that's helpful to know. So that was one little tidbit added. And please do let us know if you are interested in more information about how to become a claim counselor. But the ship is here to help, so that's all I have.
Well, as we await if anybody has anything to submit to us on the chat, there was a curiosity as to if somebody is brand new to Medicare and they call you, can you give us a feel for what they're going to experience on the other end of the phone and how, kind of the process of what they're going to go through, how you handle things on your end?
Sure. Yeah, thanks for that question. We have to start with some questions to find out more about the person. So if they are retiring and new to Medicare and their spouse isn't employed with their employer group health plan, then going on Medicare is the thing they want to do. there are people who, if they're able to go on Medicare, in other words, they've turned 65, but they're still employed, or their spouses with an employer group health plan, then they could turn down their Part B if they want to, because you do have to pay for your Part B. So they could turn their card back in and just have A only. Most people who have worked have earned their A coverage. So we would find out, we would also probably ask the money questions to see if we can help them save money with either limited income subsidy, MORX, however that fits. We would inform them of the supplement choices, because Medicare was never designed to pay for everything. There are gaps in Medicare. That's why they call this Medigap. And so if they can afford it, it's a good thing to have this coverage. And so we will let them know about this and what it pays, because it really does pay well, and it can take the worries out of bills. So the thing is, though, you have to kind of anticipate down the line, 20, 30 years from now, what kind of coverage do I want? And that's usually what you have to start with. So you might be paying a little extra, but it's kind of like car insurance. You don't want an accident, but you have to pay for it anyway. So we'll inform about Medigaps. We can answer questions about how they compare to a Medicare Advantage plan. We would help them find their best drug plan option by putting in their drugs. You do that 1 month before you need to start. So if your Medicare is going to start in December, actually, if it starts in December, we'd look for your plan early November so you could get your card before it starts. But then we'd also look for a plan for the following the following month, just to make sure you're in this best plan. And sometimes the best plan for this year, even 1 month, isn't the best plan for the following year. That can be complicated, but so you would want to find out how you want to get your original Medicare, either through A and B, possibly with a supplement, or with the Advantage plan, and how you want to get your drug coverage. So that's pretty much what we do.
Well, I don't see any other questions rolling in right now, but we will send you the information in a follow-up email that she talked about today, those same kind of documents that you already had links to underneath the video window. We'll scan in this other document and send that along as well if folks are interested in that. And in the meantime, we will thank Sandy for her time and her expertise today. We'll thank you for your attendance. Stay tuned to the calendar at the MIMHtraining.com website, because we have a number of these web conferences that are going to be popping up in the very near future. There's several more in the works that I think you're going to find very, very interesting to join us for. So we hope you get a chance to do that. Again, thank you for your time. And Sandy, thank you for yours.
Oh, thanks, Tom. It was a pleasure. Thanks, everyone.